Welcome! Today's topic is teledermatology. Meet Chris. He is a 26-year-old that lives just outside of Cornwall, a rural town in Ontario, which only has one hospital. He notices that he has a rash on his lower arm. He's had it for about 3 weeks, and it looks like it's getting worse. It has an itchy, red, rough, flaky, and dry texture. Chris decides to see his family doctor, Dr. Cruz. She suspects that he has eczema, but she isn't sure. So she tells Chris he needs to see a dermatologist. Unfortunately, the appointment wait time is expected to be 12 weeks or longer. She tells Chris that his condition is getting worse, and he should probably consider teledermatology. She explains that teledermatology is the use of technology to exchange patient information for diagnosis and treatment of skin conditions. She mentions that there is a center that just opened up in town called a Teledermatology Center. They do wound care, triaging, preliminary diagnosis, treatment plan administration, and follow-up care. Chris asks Dr. Cruz why it would be better to go to a TDC instead of seeing a dermatologist in person. Dr. Cruz explains that the main reason teledermatology is a good option for Chris is because of shorter wait times. Dr. Cruz says she knew of one patient that had to wait 6 months to see a dermatologist in person. Since Chris lives in such a remote area, the nearest hospital to him is the Cornwall Community Hospital, which does not have great availability for dermatologists, and there are very few specialists in the area itself. Dr. Cruz explains that the great thing about teledermatology is that it uses store and forward technology or live video conferencing to deliver the same type of care a patient would get from an in-person dermatologist consult. The more commonly used method is store and forward, which involves having a healthcare professional take a photo of the area of concern, which is then sent to a dermatologist for review. Meanwhile, live video conferencing operates similarly to face-to-face consultations. Patients and clinicians utilize an audio and visual system to communicate. A patient can get an appointment almost immediately. Within 5 days, Chris can have a diagnosis and treatment plan ready. Since teledermatology is more accessible, Chris won't have to drive long distances or worry about money, time, and gas. Chris thinks that this is a good solution, but he wonders if this will be as accurate as an in-person consultation. Since it is just a picture, he is unsure if the doctor will fully understand his condition. Dr. Cruz tells him that although this is a new practice, there has been recent research that has shown that approximately 90% of patients who have used teledermatology services are satisfied with the overall experience. This is because it's cheaper, closer to home, saves time, and allows for quicker diagnosis and administration of the treatment plan. Most teledermatology patients surveyed felt that it was comparable to in-person consultations. Chris thinks that this is an interesting option and decides to check it out. Chris goes to the nearest TDC, located close to his home in a small office. Chris walks in and registers with the front desk. Almost immediately, he is greeted by a registered nurse who takes him to the consultation room. Then the nurse takes his vitals, records his symptoms, and takes his patient history. The nurse then proceeds to take 3 high-quality images of his rash using a specialized digital camera. She takes 1 more image using a telemicroscopic device. She then forwards these images to the dermatologist. The nurse explains that he will have his results within 5 days, but if anything changes in that time, he can take a photo of his rash with his phone and send it to the nurse. 4 days later, Chris returns to the TDC to receive his diagnosis. The nurse tells Chris that he has eczema, which is a common condition that can be treated with a topical cream, and that he does not have to see a dermatologist in person. The nurse gives Chris his prescription and tells him that he is able to fill the prescription at the pharmacy next door. For a follow-up once a week, Chris needs to take a picture of his rash and send it to the nurse as a method of tracking his treatment and progression. Chris realizes that he had a really great experience with the TDC. He looks to see if there are more centers for his aging grandmother who lives in rural Alberta. He finds that there are a few centers located in Alberta as well. He likes that it is funded by Canada Health Info, as the Canadian government is increasingly investing in digital health initiatives. Chris finds that in order for TDCs to work efficiently, provincial governments and non-profit organizations have to consistently evaluate each center for long-term patient outcomes. Chris also finds that the cost associated with a teledermatology appointment is less than the ones associated with a conventional dermatology consultation. If the Canadian government invested more in this solution, they would be able to minimize their costs of providing dermatological care and save money in the long term. In conclusion, since Chris really liked his experience with the TDC, he believes that it is a good solution that provides more accurate, timely, and accessible care for inaccessible populations in Canada. Finally, he hopes that more TDCs will open in Canada to help further address these issues.